In Health Matters today, we're talking about a common problem for a lot of people, and that's GI issues. And that includes upset stomach, all kinds of things like that. News Channel 3's Hattie sits down with an expert at Cabell Huntington Hospital with more.
Hey there, Dr. Akash Ajmera is with us today from Cabell Huntington Hospital. He is a gastroenterologist, so he deals a lot with GI issues. So we're going to be talking about that today. Just give us an idea of what this field covers.
Sure. Gastroenterology basically covers the intestines. So starting from your food pipe, your stomach, your small intestine, the large intestine, anything to do with that, this field would be involved in it. But it also covers the liver, the pancreas, the ducts that drain the liver and the gallbladder and the pancreas. It has to do a lot with nutrition and digestion issues too. So and we do a lot of procedures to deal with any issues that go on with these systems. So basically it covers all these areas.
So a lot of liver problems, a lot of digestion kind of issues. Talk about the patients that you see and what conditions they're actually dealing with.
Sure. We usually see patients with common complaints like abdominal pain, nausea, vomiting, diarrhea, which could be going on for a short or for a period of years. We have a lot of people who have trouble swallowing, people who have bleeding from the gut, either from the upper gut or the lower gut. A lot of different issues like ulcers and Crohn's disease, ulcerative colitis can give you pain and bleeding and issues like that. In the liver, you see a lot of patients with chronic hepatitis, patients with alcoholic liver disease, patients who have chronic pancreatitis from either genetic causes or drinking too much or having gallstone disease. So basically we see a lot of things, a lot of different kinds of things.
And your take on this region, would you say that hepatitis and alcohol disease, is that a common thing? I
would say a bit more common in this area. People with drug abuse problems, people with alcohol problems, with psychiatric issues, they have certain things that we see in our field, like hepatitis, alcoholic liver disease, alcohol-related pancreatitis, a lot of gut issues that can come up with these behaviors too. For some reason, we see a lot of more Crohn's disease and ulcerative colitis than I would expect to see in this part of the world.
Okay. When is it important to see a gastroenterologist?
I would say, first of all, patients should have colon cancer screening, which is a very important thing I want to point out. But other issues, like if you have been ever diagnosed with Crohn's disease, ulcerative colitis, who have been diagnosed with chronic hepatitis B or chronic hepatitis C, these patients should always follow up with a gastroenterologist. Even though they don't seem to have symptoms from it, it's important to make sure that their disease is under control all the time, because it can always flare up at a later time and be coming back with a vengeance. If you have cirrhosis or end-stage liver disease, it's important to see a gastroenterologist.
Okay.